You've been walking down the street, maybe carrying your groceries, and you suddenly realize your legs just don't feel as strong as they used to. It's not just tired, but a persistent weakness, almost like they're giving up on you. It's easy to brush it off. After all, you're over 60, and everyone says that's just a part of getting older, right? But here's the thing, sometimes that weakness is your body's quiet way of telling you there's trouble brewing. Trouble that could put your feet, and even your mobility, at serious risk. Imagine one day looking down and realizing that a simple walk in the park is no longer possible. Not because of age, but because something inside you has been slowly cutting off your body's lifeline to your legs. In this video, we're going to open a window into what might really be behind that creeping weakness. We'll talk about hidden causes most people never think about, how to recognize the early whispers before they turn into shouts, and simple steps you can take starting today to protect your feet for years to come. If you're curious to know whether your legs are trying to warn you, drop a 1 in the comments. If you're feeling confident they're just fine, type 0. And of course, make sure you hit subscribe to channel, because the next few minutes could change how you think about your legs forever. Now, let's get into what's really going on beneath the surface. Weak legs, a sign of a chain of hidden risks. When your legs start to feel weaker, it's easy to shrug it off and think, it's just age catching up with me. But leg weakness can trigger a chain of events that puts your feet in serious danger. Often, in ways you won't notice until the damage is advanced. One of the most common hidden culprits is poor circulation, known medically as Peripheral Artery Disease, or PAD. Think of your arteries as busy highways delivering oxygen and nutrients to every cell. With PAD, these highways get narrowed or even blocked by fatty plaque buildup. When the arteries that feed your legs and feet are affected, blood flow slows to a trickle. Without enough oxygen-rich blood, the tissues in your feet begin to starve. Early signs can be subtle: cold feet even when the rest of your body feels warm, pale or bluish toes, or a cramping, squeezing pain in your calves after a short walk. That pain isn't simply old age. It's your muscles begging for oxygen. This is where things can escalate quickly. Imagine getting a tiny blister from a slightly tight shoe. For someone with healthy circulation, it heals within days, but with PAD, your body's repair crew, oxygen, nutrients, immune cells, can't reach the wound fast enough. The sore lingers, infection sets in, and if it spreads deep enough, the skin and tissue begin to die. That's gangrene, and in many cases, the only way to stop it is amputation. Another hidden threat is peripheral neuropathy, or nerve damage. It's common in people with diabetes, vitamin B12 deficiency, or heavy alcohol use. Damaged nerves fail to send accurate signals, meaning you may lose the ability to feel pain, heat, or pressure. You could step on a sharp object or develop a blister without realizing it. Keep walking on it for days, and by the time you notice, the injury has worsened dramatically. Muscle weakness adds another layer of risk. Your calf muscles do more than help you walk. They act as natural pumps, pushing blood back toward your heart. If these muscles weaken from inactivity, illness, or injury, the pump slows down. Blood pools in the lower legs, swelling increases, and the skin becomes fragile. This sets the stage for pressure ulcers on the heels or toes, another gateway for infection. Robert's story, a wake-up call. Let me share Robert's story. Robert, a 72-year-old retired mechanic, loved his morning walks. One month, he noticed his legs felt sluggish, but he ignored it, assuming he was just tired. Weeks later, while gardening, he felt a sharp sting in his foot. By that evening, the pain was gone, not because the injury healed, but because his nerves had gone numb. His wife spotted a deep cut on his big toe. At the clinic, tests revealed severe peripheral and nerve damage. The cut was already infected. Robert spent weeks in the hospital and narrowly avoided losing his foot. Later, he admitted, "If I'd gone to the doctor when my legs first started feeling weak, I might have avoided all of this." The truth is, weak legs aren't just a strength problem. They can signal that your circulation, nerves, and muscles are all under stress. When these three systems start failing together, the danger to your feet becomes immediate and severe. Pay attention to those early changes: cold feet, unusual pain, slower walking speed. Catching the problem early can mean the difference between preserving your mobility and facing life-changing surgery. The root causes. Why this happens. Now that we've explored what to watch for, let's look at the root causes. Because the earlier you understand them, the more power you have to stop the damage before it starts. When we talk about why legs grow weaker and feet become more vulnerable, the answer is rarely a single cause. In most cases, it's a chain of interconnected factors: health conditions, daily habits, nutrition, and even footwear choices, that gradually wear down your strength over the years. The tricky part is, these factors often work together silently, magnifying the damage without you noticing until the signs are obvious. Let's begin with underlying health conditions, because they often set the foundation for trouble. Diabetes, one of the most common culprits. Persistently high blood sugar slowly damages both the blood vessels and the nerves. This double blow means your feet not only receive less oxygen-rich blood, but also lose sensation. Without that feeling, you may not notice injuries, pressure spots, or infections early on. Peripheral artery disease, PAD, another stealthy threat. It narrows and hardens the arteries, cutting off circulation to the lower limbs. Kidney disease can trigger fluid retention and swelling, which strain the skin and tissues, making them fragile. Heart disease affects the pumping power of the heart, reducing the force and efficiency of blood flow to your legs and feet. Nutrition plays a much larger role than many people realize. Deficiencies may develop slowly, but their impact on muscle, bone, and nerve health is profound. A lack of vitamin D weakens muscles and reduces bone density, increasing the risk of falls and fractures. Too little vitamin B12 damages nerves, leading to numbness or tingling. Low vitamin C and zinc impair your body's ability to repair tissues, slowing wound healing. Lifestyle choices can quietly push the situation from risky to dangerous. Smoking constricts and damages blood vessels, starving your tissues of oxygen. Excessive alcohol use harms nerves, disrupts blood sugar balance, and depletes vital nutrients. Long periods of sitting or inactivity allow blood to pool in your legs, causing swelling and lowering oxygen delivery to your muscles and skin. Foot care is another piece of the puzzle that people tend to overlook. Shoes that are too tight or poorly cushioned can create pressure points and small wounds. Solutions. Take action today to protect your feet. Now that you know what to watch for, the next step is even more important. Taking action today to protect your legs and feet for the long haul. Prevention doesn't have to be complicated, but it does have to start before the damage is done. When it comes to protecting your legs and feet, the good news is that you have more control than you might think. Even if you already have some circulation or nerve issues, there are practical steps you can take starting today to slow down damage and even improve your condition over time. It's not about making huge, overwhelming changes. It's about building simple habits that stack up to real protection. 1. Improve blood flow. Movement is the best medicine for your circulation. Just a 20 to 30 minute walk at a comfortable pace can make a big difference. If walking is tough, try light chair exercises or moving your ankles in circles while watching TV. 2. Get the nutrition you need. Include foods rich in omega-3s, like salmon or walnuts, to help keep your blood vessels healthy. Leafy greens like spinach or kale pack vitamin K and antioxidants. while citrus fruits and berries give you vitamin C to speed healing. 3. Break harmful habits. If you smoke, quitting is the single most powerful thing you can do for your circulation. Cutting back on alcohol helps protect your nerves and keeps your vitamin levels from dropping. 4. Practice daily foot care. Check your feet every morning or evening, using a mirror to see the bottoms if needed. Look for any cuts, blisters, redness, or swelling. Wear shoes that fit comfortably. Tight shoes can rub and create wounds before you even notice. Final message. The truth is, preventing foot problems isn't about perfection. It's about paying attention and acting early. Every small step you take to improve blood flow, eat better, drop harmful habits, and protect your feet is an investment in keeping your mobility and independence for years to come. So, here's my hope for you, that you keep moving, keep caring, and keep noticing the little things that make a big difference. If this message opened your eyes, share it with a friend over 60. You might just save their mobility. Drop the words, "Protect my feet," in the comments so we know you're in this with us. And don't forget to subscribe, because your next step toward healthier legs could start with our next video.